So postpartum depression is, it can often be confused with, we talk about the baby blues a lot, and when we talk about women and having babies. The blues looks more like, some mild sadness, maybe having some difficulty sleeping, things like that, maybe a little bit of change and whatnot. It's a very overwhelming time, right, and a big change has taken place. But where it becomes postpartum depression is where that continues for longer than a couple of weeks, to where, especially when there's difficulty sleeping. I think a great way for somebody to ask themselves, am I struggling with something like postpartum depression? A lot of women will say, I just don't feel like myself anymore. They often feel withdrawn. It's difficult for them to connect with other people, sometimes connect with their baby. Usually their babies are very well taken care of, but there's a struggle to connect. Everything feels very overwhelming. There can be just a lot of sadness that they can identify and being emotional. And one thing that I think that's interesting too is there can be irritability and maybe not as patient and maybe easily upset over things that they normally wouldn't be. And again, I think it's important to make that distinction because, again, sometimes we picture something like depression as laying in bed, not being able to function, but it can come in other forms. Of course, it can be having things like suicidal thoughts, or thoughts come to your mind that don't maybe feel like they're coming from you, thoughts of even harming your baby, images that come to your mind, things like that. And all of those symptoms can be experienced on different levels. And I think it's important for people to understand with postpartum mood disorders that it's not just depression. When we're talking postpartum mood disorders, we're talking anxiety, we're talking OCD, we're talking post-traumatic stress disorder, we're talking psychosis. And so something that's really important to be aware of even is that it shouldn't even just be lumped into depression, because if someone's experiencing anxiety and having panic attacks, that's different than the symptoms I just mentioned with experiencing depression. Or if the birth was traumatic, then we need to address the issues with the trauma and the anxiety that's coming about because of that. Or a mom who's struggling with something like OCD, who is very repetitive behaviors with protecting her baby or being overly concerned about safety or other things. Those are actually different things, and so it's really important to be able to understand those distinctions and not even just lump everything into postpartum depression.